Hello, good afternoon, everyone. Hope you guys had the chance to eat something lunch, and now we're gonna start the tutorial on the cardiovascular system. Okay, in case you have not downloaded a copy of the study guide, I'm gonna post a link in the chat box for you to download. Okay, so there it is. Sorry, just gonna set a few things here. Okay, there we go. All right. I've also turned on auto captioning. So for those of you who need captions of what I'm saying, you can turn that on Zoom. Okay, let's get started. First question here. Name some major blood vessels that supplies different organs. So for vessels that are going to the head, we have the carotid artery. Okay, they just kind of run up, along the side of your neck, and it supplies oxygenated blood to your brain. And coming back down from the brain, from the head, we have the jugular vein. Going to the lungs, we have the pulmonary artery. So the pulmonary artery connects from the right ventricle of the heart, and it will pump the blood to both of your lungs. And coming back, we would have the pulmonary veins. The heart cannot use the blood within its own chambers. They're passing by really quickly and with quite high of a pressure. So instead, they rely on a network of blood vessels that are embedded in the myocardium, and that is what we call the coronary artery. Okay, and of course, we also have coronary veins. Okay, if you block the coronary arteries, you might have a heart attack. Kidneys. Anybody know the name for the vessels that supplies blood to the kidneys? That's right, renal artery. And renal vein. Last but not least, we have the liver, which is the hepatic artery. You might have heard of hepatitis. It's the same root word, inflammation of the liver. And this would be the hepatic vein. Of course, there are many more vessels, but these are the ones that I want you to know. Okay. Adriana, I see that you are unmute. Do you have a question? No. Okay. Next, we have a flow chart that shows the blood flow. Of course, it's a cycle, so technically there's no beginning or end. It just keeps on looping itself. But generally speaking, we do describe the blood flow starting at the superior and inferior vena cava. Okay, so the superior vena cava collects blood from sort of like the upper 1/3 of the body, and the inferior vena cava will collect blood from the inferior 2/3 of the body. And both of them are going to connect and pour the blood into the right atrium. Okay, so for those of you who just need a quick refresher, if you're looking at the heart from the front, you have the right atrium here, left atrium, right ventricle, and left ventricles. Okay, this is a front view, which is why the right and left are kind of mirror imaged, right? From the right atrium, it is going to go through a valve. That is a valve that has 3 flaps. We call it the tricuspid valve. and the blood will go into the right ventricle. Okay. From the right ventricle, we will squeeze the blood, the heart will squeeze the blood through the pulmonary valve, which is located within the pulmonary artery. Okay, and that's going to take the blood to the lungs for reoxygenation. And afterwards, we will return the blood to the heart through the pulmonary veins. Okay, I'm just going to keep them singular here. And we're going to return the blood to the left atrium. The blood will go through another valve. This time is the bicuspid valve. Instead of having 3 flaps, it only has 2 flaps. A tricycle has 3 wheels, a bicycle has 2 wheels, right? So tricuspid valve, 3 flaps, bicuspid valve, 2 flaps. Okay. Sometimes the textbook will call this the mitral valve, okay? Or mitral valve. It's the same thing. And then through the bicuspid valve, it will go into the left ventricle. Okay, and finally, the left ventricle will create a very forceful squeeze, a strong squeeze that will squeeze the blood through the aortic valve, which is found within the aorta. And then the aorta is going to distribute the blood throughout the body. And eventually from there, it is going to go all the way back to the heart via the vena cava. Any question about any of these? Okay, let's highlight some of these things. For example, we can highlight the tricuspid valve and the bicuspid valve. Okay. Collectively, what do we call these valves? Can anybody help me out here, please? Oh, thank you, Tyler. That is the AV valve. That's correct. Atrioventricular valve. Okay, so they are a pair of valves that would be opening and closing at the same time. Then we have a second pair, which is the pulmonary valve here, as well as the aortic valve. So what do we call those? That is correct. Tyler, Adriana, and Jean, these are the semilunar valve. Okay, semilunar valves. There we go. Okay, so the AV valves will open and close together in synchrony at the same time as each other, but then they would be out of phase with the semilunar. So if the AVs are open, the semilunars will be closed. And then when it's time for the AV to close, the semilunar would open. Okay. I'm going to add some more colors here. We're going to use red for oxygenated blood and blue for oxygen poor blood. So this is O2 rich and this is O2 poor. Okay, it doesn't mean it has 0 oxygen. It still has some. It's just not as much. Okay. So the vena cava, they will be blue because it just collects it from the body after they are being used. Blue in the right atrium. Okay, never mind the valves. And then right ventricle, pulmonary artery. All these structures are going to contain oxygen poor blood. Once you get to the lungs, we will reoxygenate it. So we will go from oxygen poor to oxygen rich. And then everything after that is going to be oxygen rich. Until it goes to the body, then the oxygen will leave the blood and go into the tissue. When it's done, it will go back to the heart through the superior and inferior vena cava. Does anyone have any question? Okay. Let's try a poll question. Okay, anyone else? Yeah, most of you got it right. Left atrium receives blood from the pulmonary veins. The answer is C. If you're not sure, you can just look back at the flow chart that we just did, right? We look at the left atrium, the structure that is immediately before the left atrium is the pulmonary vein. Okay. Alrighty, let's move on to the next question. Circle either artery or vein that match each of the following description. First one, higher blood pressure. Okay. Is it artery or is it vein? Well, the pressure is caused by the contraction of the heart. So if the structure is closer to the heart, it will have higher blood pressure. That would be artery for this one. Because the artery has high blood pressure, we need them to have thicker walls as well, so that they are able to withstand that pressure. If the wall is weak and the pressure is really high, it's possible that it will rupture. And that is, of course, bad news for many reasons. Larger lumen diameter. Lumen just means the inside of the blood vessel. Okay, so if you think of the blood vessel like this, here, right, the inside right here, that's called the lumen. This is a fancy word, okay, for the inside. So which one has the larger lumen? Adriana said veins. That is correct. The veins are much bigger in diameter compared to the arteries. Contain valves. Does artery contain valves or vein contains valve? It is the veins that has the valves because the pressure in the veins are quite low, and we need the valves to help return the blood to the heart, right? Okay. We call that venous return. More on that later. Now, in the past, I had students who got a little bit confused. They're like, well, you know, if you look at this, you said that the pulmonary valve is found in the pulmonary artery. So isn't that a valve in the artery? This is talking about like in general, right? So in general, if you look at all the veins and all the arteries, the veins are definitely the ones that are going to have the majority of the valves. Okay, arteries, maybe there is the exception with the pulmonary artery, but it's definitely more ubiquitous in veins. Blood has higher velocity. What do you think? Is it faster in artery or is it faster in vein? Georgia, Tyler said artery. That is correct. Okay. And last but not least, carries blood away from the heart. That is also artery. A for away. So you can almost feel that this can be a multi-select question, right? those questions that have more than one possible answers. I could list a bunch of these things and then ask you which of the following are true regarding arteries or regarding veins, right? And then you have to select the proper ones. Okay, moving on. This is the part where you should have some colors and maybe some highlighters or something. Label the chambers of the heart. Use blue and red to indicate oxygen level. Okay. So over here, these are the 4 chambers. Okay. So this one is the right atrium. Okay. And again, like the left side of the diagram is right because we're looking at it from the front. This is an anterior view. Front view. Okay. Below the right atrium, we have the right, oops, wrong color. We have the right ventricle. Okay. So blue is oxygen poor, right? O2 poor. And red is O2 rich. So over here, we have the left atrium receiving fresh blood from the lungs. And the blood's going to go down to the left ventricle. Label the structures leading to and away from the heart. Use blue and red to indicate O2 level. So we have the superior vena cava here. Superior vena cava. Okay, so again, right, if you think about the body, and the heart is about here. Okay, so the top 1/3, the blood would be collected through the superior vena cava. Okay. Oops, heart should be that way. And then we have the inferior vena cava, which is down here. And just a reminder, the plural for vena cava is venae cavae. It's a bit weird, but you add an E to it. Okay. Then we will send the blood to the lungs through this structure right here. That is the pulmonary artery. Coming back from the lungs, once again, we have the pulmonary veins. Okay, so you have some from each side. Goes to the left atrium, to the left ventricle, and then finally, it's going to go through this big one here. What is the name of this big one? That is the aorta. That's correct. Now, the aorta actually arches back, and then it will come down like that. Okay, it will come down like that, and then it will become what we call the abdominal aorta. It will go through the diaphragm. Okay, it'll go through the diaphragm, and then it will branch into the renal artery. Okay, so something to keep in mind, right? Like when you do the kidneys later on, it's a continuation. All right, name the 4 valves of the heart, and you know I will post this after class, obviously. So if you missed anything, don't worry, you will be able to look at it after as well. So there is a pair of valves here on the right side, and then we have another one here on the left side. One's on the right, we call that the tricuspid valve. Tricuspid valve and the bicuspid. And again, these tricuspid, bicuspid, they are atrioventricular valves. We have another valve right here at the entrance of the pulmonary artery. So that is the pulmonary valve. And also another one here leading into the aorta. That's the aortic valve. And collectively, they are the semiluna. Hope that makes sense. Again, just ask questions if you have any. Okay, we're going to start at the vena cava, and we will trace out the path of blood flow in the heart. So from the vena cava, it's going to go into right here, the right atrium, through the tricuspid valve, and then into the right ventricle. Then we're going to go through the pulmonary artery. Okay, that's going to lungs. Okay, to the left lung, to the right lung. And then we're going to come back. I'm going to come back through these pulmonary veins from lungs into the left atrium, left ventricle, and up we go through the aorta. So this one will go to the right side of the body, the right arm primarily. It's going to go up to the head. It's going to go to the left arm. And don't forget, this will actually arch back, right? And form the abdominal aorta, like I told you. And then it will go to supply the bottom part of the body. Okay. So, you know, kidneys, liver, intestinal tracts, all those things. This is the main one that goes down. Are we together? All right. Let's do another poll here. This one is multi-select, I believe. Go ahead. Okay, just a couple more seconds for anyone else who wants to participate. All right, let's take a look. First one, the bicuspid valve divides the right atrium from the right ventricle. That is incorrect. It is supposed to be the tricuspid. Okay. If you look at the diagram we did, tricuspid on the right, bicuspid on the left. And again, for those of you who still might be a little bit confused, the right and left are reversed because we are looking at it from the front. Okay, so you must know that this is the left side and this is the right side when we are looking at it from the front. Second one, aortic and pulmonary valve prevents the backflow of blood into the atria. Okay, so aortic valve and pulmonary valve, if we look at this flow chart here, aortic valve prevents backflow into the left ventricle, and pulmonary valve prevents the backflow into the right ventricle. Okay, so that means this statement is not correct. It's supposed to go prevents the backflow of blood into the ventricles. Okay. The tricuspid valve separates the right atrium from the right ventricle. Yeah, that one's correct. The AV valves, which is the tricuspid and the bicuspid, prevents backflow of blood into the atria during ventricular contraction. So that is also correct. Okay, so most of you got it right. C and D. Very nice. Okay, let's move on to the next page. What have we got here? List 3 factors that affects blood pressure. Briefly describe how each factor affects blood pressure. So first of all, what is blood pressure? Blood pressure is basically the force of blood pushing against the vessel wall. Okay. So Adriana said one of the factors that affects it would be total blood volume. That is correct. Okay. Total blood volume. Okay. So generally speaking, higher blood volume equals to higher blood volume equals to higher blood pressure. Okay, it makes sense, right? Like if you fill it up more in a limited capacity setting, then you're gonna have more blood pressure. People who suffer from hypertension, like high blood pressure, sometimes they will take what we call a diuretic. Okay, diuretic, or also known as the water pill. Does anybody know what this is? Anybody want to tell me what this might be? What does it do to high blood pressure? If you have heard about it before.
Yeah, diuretics make you pee more.
Okay.
Yeah, exactly, right. And John, you were going to say the same thing as well, I assume?
Yeah, it's just decrease your blood sodium level, just decrease your blood pressure.
Exactly, right. So as the name implies, right, diuretic makes you pee more. Okay, by peeing more, you will lower your blood volume and therefore bring your blood pressure down. Right? That's what's called a water pill. You take it and then you pee out all these water. So your body has mechanisms to regulate blood pressure, but when those mechanisms fail, then you will need medication, and that's one of it. Okay, you will learn that in more detail in the kidney unit. Okay, sorry, I went on a tangent. Let's come back to this. Second factor, stroke volume. That is correct. Stroke volume. Okay, and just in case you need a definition for stroke volume, that is the volume of blood ejected from ventricle. per squeeze, right? Per contraction, if you want. Okay, so the harder you squeeze, the higher the blood pressure is going to be. So higher stroke volume equals to higher blood pressure. Okay. And finally, vessel diameter. Vessel diameter. And we have two situations here. We have vasoconstriction. So vasoconstriction means smaller diameter, which equals to higher pressure, higher BP, blood pressure. Vasodilation is the opposite of vasoconstriction, and that is going to lead to larger diameter and therefore lower BP. Okay. Next question. List two problems that needs to be overcame for venous return. First of all, what is venous return? Venous return is basically returning blood to the heart. Okay. So we got a bit of a problem when we try to take the blood back to the heart. And again, here is the generic human. The heart is right here. So that means all this blood that's below the heart is going to need to go against gravity in order to return to the heart, right? So that's the biggest problem. Number one, gravity. Okay, how do you go upwards against gravity, right? So to fix this problem, we need to rely on skeletal muscle pump, okay, as well as valves. Right, so you might remember seeing a picture in the PowerPoint slides, right? So like you would have a vessel here. Of course, this is an exaggeration. And then you would have the muscle around it, okay? Skeletal muscles are muscles that you have voluntary control over, right? We learned that in the last lesson of last semester. So these are the muscle. So when you walk around, the contraction of those muscles will squeeze the veins, and then that will cause the blood to go up. But as soon as you relax the muscle, then the blood will fall back down, right? So we don't want the blood to fall all the way back down. And so what we do is we're going to put some valves right here in the veins. So when you walk, the blood goes up. And then when you relax, the blood goes down, but it doesn't go all the way back down because the valves will catch some of it. So next time you contract again, instead of starting all the way from the bottom, you will start from this point and then go up. So, you know, slowly but surely, the blood is going to be returning to the heart. Okay? So that's the first problem, and that's how we overcome that problem. What's the second problem for venous return? Anyone? Varicose veins is what happens when the valves does not work. Okay, so the blood start to pool and then the veins start to bulge. But that's not the second problem that we need to overcome. That's more of like a problem when this fails to work. Alex, is a question: how much of an effect does gravity have on blood in space? So obviously, like there is very little gravity in space, and so the circulation is going to actually no longer be affected by gravity. Okay, so you might think that the heart doesn't have to work as hard because all the blood is just going to return to the heart with no problem, because there's no gravity working against it, right? But actually, what people found is that the heart actually have to work harder, because in a microgravity environment, because everything relies on that single pump. There is no other things that are driving it, right? So if you think about it, on Earth, the heart squeeze, and then most of the blood would just be able to get to the bottom part of the body with very little effort because of gravity, right? So all that blood can go to the legs and stuff like that. But in the space with very little gravity, right? The only thing that would allow you to distribute all that blood all the way to your baby toe is the heart. So the heart actually has to work really hard to squeeze, create much more force to force all the blood to distribute throughout the body. Hope that answers your question. Okay, back to my question. What's the second thing that we have to overcome? Yeah, so it's a little bit more strain on the heart. That's correct. Okay, so this is low BP, low blood pressure. Okay, when fluid has low blood pressure, fluid can be liquid or gas. In this case, liquid. Low blood pressure causes things to flow very slowly, and so the problem that creates here is it's not going to return to the heart fast enough. So to overcome this, we are going to need to have valves, right? As well as create pressure difference between veins and the right atrium, because that's ultimately where you're going to go, right? So you want to make sure that the pressure in the right atrium is significantly lower than the veins. So even though it's low in the veins, but if there's a lower point, then it's going to go towards that point. Okay. Next question. A patient has a breathing rate of 30 breaths per minute and a heart rate of 70 beats per minute. If their stroke volume is 80 mils per beat, calculate cardiac output. So here's the formula for anybody who needs a refresher. Cardiac output, which is a measurement of the volume of blood that is distributed throughout the body per minute. And in order to calculate that, we need two pieces of information. We need the stroke volume, which is milliliters per beat, multiplied by heart rate, which would be beats per minute. That is correct, Tyler. But let's go through the calculation. 70 beats per minute for the heart rate and 80 mils per beat. So we can just sub it into here, right? Cardiac output is 80 mils per beat multiplied by 70 beats per minute. And I'm sure you learned this in math class. You can reduce it if it's the same. So 80 times 70 is 5,600 milliliter per minute, or 5.6 liters per minute. Okay, there is 1,000 milliliters in a liter. Okay, so that's how you do something like this. It's probably going to be like one calculation questions on the quiz, so make sure you know how to do it. I think it's pretty straightforward, right? You just multiply them together. All right, next, complete the following chart regarding osmotic pressure and blood pressure. Now, this was explained in a lot of detail in the lecture recording. So watch a couple of times if you have trouble understanding it. Right? So basically, osmotic pressure and blood pressure are two opposing forces that governs the movement of material across the capillaries. Okay, so capillaries are the smallest blood vessels. That's where the exchange of nutrients occurs, exchange of waste product. Right? So what governs the movement of material into or out of the capillaries depends on three things. We talk about diffusion. That one's the easiest one to understand. You learned it last semester. Things naturally go from high concentration to low concentration. And then there are two additional forces that would affect the movement of material. One of them is osmotic pressure. The other is blood pressure. So let's talk about osmotic pressure. What is osmotic pressure? It is created by solute. Oh, that's not a nice color. Let's do something darker. Solute concentration gradient. A gradient just means there is a difference between 2 points. So if there are more solute from one side to the other, that's going to create what we call osmotic pressure. And fluid move towards higher solute concentration. Okay, we talked about this last semester, right? When we learned those hypertonic, hypotonic stuff, right? But just as a refresher, let's say I have two chambers. Okay, there's a semi-permeable membrane here, and we're gonna put some solute in here. All right, so solute. Okay, these red balls are solutes, and they're too big to cross the membrane. So my question is for you: does the water move to the left, or does the water move to the right? Okay, I'm talking about the water. So this is part A. A is moved to the left, B is moved to the right, and C is no movement. Okay, it's time for another poll. Let's go for it. Okay, in case you missed the question, here's the question. You have a semi-permeable membrane here that separates the two sides, and we have some solutes here represented by the red dots. The solutes cannot move through the membrane. So only water can do that. So my question is, which way will water move? Choose A for left, B for right, C for no movement, and if you're not sure, choose D. Just choose something, okay? So I know you are there. Okay, 15 out of 21, not bad. See if we can get a few more responses. 6 more people. All right, I think that's as many responses I can get out of you guys. And the correct answer is to the left. That's right. Okay, so this has higher solute concentration, right? Higher solute. And this has lower solute. And remember, the red balls can't cross the membrane. So the only thing that could move is water. And water will move this way to try to dilute out the concentration. Okay, so this pull, this suction of fluid towards the end that has higher solute, that is what we call the osmotic pressure. Okay, that only happens when there is a difference in solute concentration. All right. Okay, let's talk about blood pressure. What creates the blood pressure? Well, we mentioned that earlier, right? The blood pressure is caused by ventricular contraction. When the ventricle contracts, it creates a pulse that would be propagated, transferred down the blood vessels. That in turn causes the blood to push onto the vessel wall, creating blood pressure. So that's the force of blood pushing. I think I wrote this down earlier already, pushing against the vessel wall. There we go. Okay, effects on capillary exchange. So again, I drew this before in the recording, but just have a really quick one here for you to see. This is my capillary, okay, and one side it's connected to the arterial, so we call that the arterial end, and this would be the venous end. And what happens is, if you look at the solute concentration, a solute is basically anything that's dissolved in the blood, right? Okay, so we have a lot of, let me just put some example here. You will learn that next week, okay? But just give you some example. What kind of stuff do you find in blood? Well, first of all, there are lots of cells. Okay, there are proteins, there are electrolytes. Okay, so all these things would contribute to the solute concentration on the inside of the vessel. And then on the outside, you would have some as well, okay? But it's a lot higher on the inside than outside. And so osmotic pressure will cause fluid to move into your blood vessel. Okay, why is the arrow not working? There we go. All right, moving in like that. Okay, so the effects would be to draw fluid into the capillary. Okay. Is that okay, Holly? And then what about the blood pressure? Well, blood pressure, if you think about a hose and then you poke a bunch of holes in the hose and then you turn on the tap, water's going to squirt everywhere, right? So that's kind of like what blood pressure is doing. It will push fluids out of the capillary. Okay, so that's why there are two opposing forces, right? They work against each other. So on the arterial side and the venous side, the osmotic pressure is pretty much the same because the solute concentration does not change substantially from one side to another. So it will be the same OP on both sides. Whereas for the blood pressure, because the closer you are to the artery, to the heart, the higher it is going to be, right? Okay, so you're going to have all these blood pressure arrow, but as you go towards the venous side, it's going to decrease. So BP is higher on the arterial side than the venous side. Okay. So what does it mean? Well, on the arterial side, you have more forces pushing things out than you do bringing things in. That will result in fluid loss. Right? Fluid loss. And then here you have more force driving things into the capillaries than you have force pushing it out. So you will have fluid gain. If you watch the recordings, you will know that the amount of fluid that is pushed out is not going to be entirely brought back into the capillary. Some will remain on the outside. And what's the purpose of that and why are we doing it like that? You will learn next week. But that's as much as I want to talk about for now. Any questions? Again, right, like a lot of concepts going on here in the course, very, very heavy. Make sure you ask lots of questions, okay? Read the notes, do the study guide several times, okay? Don't worry, the first quiz, I make it easy, right? So, you know, everybody will feel good, and then it gets harder as we go on. Okay, let's see. Let's try this one. That should be pretty straightforward. Go ahead. Yeah, okay, I'm gonna end it early. All of you who answered got it right. Cardiac output is stroke volume times heart rate. Very good. Okay, what about this one? This is multi-select. Okay, just a little longer. Okay, let's take it up. Which of the following will increase blood pressure? Decrease total blood volume. So that's not it. If you decrease the total blood volume, your blood pressure is going to drop. Reduction in blood vessel diameter. That is vasoconstriction. Squeezing your blood vessel will cause the blood pressure to go up. Right? Just look at the chart that we did, right? So B is the correct answer. Increased cardiac output, right? Increased cardiac output will also increase your blood pressure. Right? Remember, cardiac output is dependent on stroke volume and heart rate. Increasing either of those will result in higher blood pressure. Increase in blood vessel diameter. This is the opposite of B. So if B is correct, this cannot be true. Increase total blood volume. That will increase blood pressure. And so the answer is B, C, and E. Okay. That is it. Okay, back to our study guide. True or false? Let's take a look at these. First one, the tricuspid and the bicuspid valves are both known as the atrioventricular valve. By now, you should know that it is correct, actually. Okay. That is true. What about the next one? Pulmonary artery takes oxygen-rich blood from the heart to the capillaries in the lung. Is this true or false? That is false. Okay, it should be oxygen poor. The only reason why we are taking it to the lungs is because it doesn't have enough oxygen. That's why we're taking it to the lungs to enrich it, right? So this is false. Next one, a stroke occurs when one or more of the coronary arteries are blocked. This one people usually have trouble with. What do you think? True or false? Okay. Good. Okay, we have a mix answers here. This is not true. Okay, if you have a coronary artery that's blocked, then you won't get a stroke. You will get a heart attack. Okay, a stroke occurs when one of the vessels in the head, in the brain, is blocked. Okay, it's the same thing. Something is blocked, but the location where the block occurs will determine the outcome, right? The AV node is also known as the pacemaker of the heart. That is not true. It's supposed to be the sinoatrial node, SA node. Next one. Systolic pressure is the pressure in blood vessel when the ventricles relax. Right? False. When the ventricles contract. When it's relaxed, the pressure is called diastolic pressure. Systolic is for contraction. Diastolic is for relaxation. Okay, what about the last one here? This is another one that is tricky. Osmotic pressure will increase if blood sodium level drops. What do you think? All right, we have a couple of falses, some true. Anyone else want to chime in? Okay, why is it false? Right. Okay, so this one should decrease. Okay, let me explain with the diagram. Okay, capillaries. Okay, we have all these solutes, right? Okay, and then we have some solute here. So those difference between the inside and outside, that will cause fluid to be drawn in, right? Now, if you decrease blood sodium level, then that means I'm going to be taking away a lot of these. Oh, this is not working out, is it? It's going to take away a lot of these solutes. Okay, so now that the difference is not as drastic, you'll still be drawing things in, okay, but just not as much, right? Okay, so the osmotic pressure, like how big the osmotic pressure is, has to do with how big the difference is between the concentration. So if the concentration is really different inside outside, then you have high osmotic pressure. So if we lower the difference by dropping the sodium level, then the osmotic pressure should decrease. Does that make sense? Already, that's an hour. Can you believe it? Time passed really quickly when you're just filling in anatomy notes. Why don't we take a 5-minute? Too much fun. Why don't we take a 5-minute break and then we'll do the rest afterwards. Okay, so see you in a bit. Okay, let's keep going. Next question. Sketch the following graphs. First one, blood pressure versus vessel type. Okay, so these graphs are available in the PowerPoint slides, but let's draw them. Okay, so on the y-axis here, we have blood pressure, BP. And on the x-axis, We can separate it into arteries closest to the heart, capillaries in the middle, and the veins. Okay, so in between the arteries and the capillaries, we have the arterioles, and then between the capillaries and the veins, we have the venules. Yeah, but for the most part, we just focus on the big ones: the arteries, the capillaries, and the veins. So what happens to blood pressure as we move from artery to capillaries and then to veins? Well, we're going to start quite high, straight out from the heart, right? In the aorta, it's going to be super high, and then it's going to drop as we get towards the veins. Okay, so the blood pressure is the highest in the arteries. Okay, specifically in the aorta, it will be the highest. In the lecture notes, you will see there's a little bit of fluctuation at the beginning, and then eventually it tapers off, right? So this fluctuation is due to, excuse me, the contraction and relaxation of the ventricle. And when it's squeezing, it's going to be high. When it's relaxing, it's going to be low. But as we get further and further away from the heart, the blood pressure will not be affected by the state of the of the ventricles. So whether it's contracting or relaxing, you won't be able to tell the difference in blood pressure when we are really far away from the heart. So that is the first one. Next is the velocity versus vessel type. Velocity, you can just think of it in terms of speed in this case. And this depends on two factors. Does anybody remember what they are? How fast does the blood flow depends on two things primarily. What are they? Yes, blood pressure. So higher blood pressure means it's going to be faster. And the second one is vessel diameter. Okay, the bigger it is, larger equals the faster. Okay, think of like more lanes, right? On a highway, it's going to go faster. All right, so here is the velocity. And then we have all the vessels here. It's going to be quite fast at the beginning because arteries, very high blood pressure. And then the vessel diameter, it's not super big, but relatively big compared to capillaries. And then we're going to have a drop here before coming back up again. Okay, so the speed is slowest at the capillaries. Okay. Cross-sectional area. That's like if you measure all the areas of the vessels, how much would it cover? Right. So there we go. We have the area A, C, and V here. And the graph looks like this. Okay. It turns out though that even though the capillaries are small individually, but you have a lot of them. Okay. No cell is more than 2 cells away from a capillary, right? That's what they say. And so you have a lot of it. So it covers a lot of area. The arteries and the veins, yeah, they are big, but you don't have a lot of them, right? Like you have a super big aorta, but you only have one of them, right? So that's not going to cover as much area as the capillaries. It's like, having one $100 bills versus having, 20 $20 bills, right? Even though the value of each one is small, but if you have a lot of them, it's going to be worth more than one big bill, right? So you can kind of think of it that way. Are you guys okay with these graphs? Any questions? Okay. Let's do the fill in the blanks. Probably the most mundane part of the tutorial, but nevertheless, it's important, right? You should create cue cards for these things on your own, right? To learn all the terms. There's so many terms to remember, right? Especially if English is not the first language, then it's really hard to memorize all these terms, right? English is not my first language, so when I had to learn all these things, the spelling and all, it was an uphill battle. So it's good to write them down as much as you can. Anyways, the first one, the 3 layers of the heart wall, starting at the deepest layer, are endocardium, followed by the myocardium, and then the outermost layer would be the epicardium. Which layer has the thickest wall? Which one is the thickest, I should say? Okay, the whole thing makes up the heart wall. Which of these is the thickest? That's correct, Tyler. That is the thickest one. Okay, that's the muscle of the heart. The endocardium is the one that is in direct contact with the blood. And then the epicardium is going to be fused with the double layer membrane that surrounds the heart, which is called the pericardium. Okay. The pericardium is double layered. The outside one is the parietal. Parietal pericardium. And the inner one, the one that is fused with the epicardium, that is continuous with the epicardium, that is called the visceral. Visceral pericardium. Okay, so these two things are like continuous with each other. Right? It's if you find it hard to visualize, like what do I mean by this? The best analogy I could come up with is grilled cheese sandwich. And you got your toast and you got the cheese. They really are two things, but then when you melt the cheese on top of the toast, the two becomes one, right? Yet you can still kind of see the two things separately. So that's kind of what the epicardium and the visceral pericardium is like. Okay. Name 2 atrioventricular valves in the human heart. We must have talked about this 5-6 times today already. So hopefully you know by now. It is the tricuspid and the bicuspid valve. Okay, tricuspid on the right and bicuspid on the left. Name the 2 semi-lunar valves in the human heart. Okay, so we have the pulmonary and the aortic valve. Okay. Oh no, it's a different question. Sorry, I thought I'm asking the same question as I did before, but no, it's different. The something has the thickest myocardium of all the heart chambers. Okay, so we have 4 chambers. We got the left right atrium, the left right ventricle. Which one has the thickest myocardium? The LV is correct. Left ventricle. Okay, because you got to squeeze so hard that the blood will go through the entire body, right? So LV, left ventricle, is the thickest. The right atrium collects blood from the superior vena cava and the inferior vena cava. Just gonna do the short form here. Not enough space to fit it in. Whereas the left atrium collects blood from the pulmonary vein. All right. Natural pacemaker. The pacemaker is responsible for setting the rhythm of the contraction, right? If the pacemaker sends signal more frequently, then your heart's gonna beat faster. Okay, all that is regulated automatically from your brain, and the natural pacemaker is the SA node. SA node. The speed of blood flow is dependent on, we talked about this earlier, blood pressure and diameter, right? Vessel diameter. Cardiac output is calculated by multiplying stroke volume and heart rate. What about the next one? Blood pressure is typically lowest in veins. That's correct. And then the speed of blood flow is typically the lowest in capillaries. You need to slow down substantially in order for you to have enough time for gas exchange and that kind of stuff. If they're just zooming by really, really quickly, you won't have time for diffusion and all that stuff to take place. So you gotta slow down when you get to the capillaries. ECG, or electrocardiogram, is a graphic record of the electrical impulses of the heart, right? Next one, the hardening of arteries due to buildup of fatty substance is called atherosclerosis. See, one thing you don't have to worry about with this online learning is you don't have to spell stuff, right? If you write this test in person, you would have to know how to spell atherosclerosis, the hardening of arteries. The coronary arteries supply the heart muscle with oxygenated blood. Hepatic artery supplies the liver. Renal arteries supplies the kidney. Two phases of cardiac cycle. We have the systole, and then we have the diastole. Okay, so systole is contraction. Diastole is relaxation. And if you measure the pressure during systole, we call it the systolic pressure, right? The 120 mmHg, right, that you will find in most textbooks. And then we have the diastolic pressure, the 80 mmHg. Okay, is the pressure, not the press. Pressure. That's it for the fill in the blanks. Okay, so here is the long answer questions. I asked you guys last time to look through it and see if there are ones that you would want me to take up. Any requests? Can we do 8? Sure. Let's do 8. Anyone else? I'll give you a moment if you haven't looked through them yet. Seven. Yep. I think the rest are pretty self-explanatory. Okay, why don't we start with 7 and 8 first? And if you guys have more requests, we'll do that. Number 7. Describe what happens in atherosclerosis and explain its relation to coronary artery disease. Okay. So blood does not like rough surfaces. Okay. Anytime blood goes through a patch of rough surface, they have a tendency to clot. All right. That's why if you have a thumbtack that goes into your blood vessels or something, that causes all the underlying tissue to be exposed. So when you remove the thumbtack and you're like bleeding all over the place, what happens is the blood is coming this way, and then it encounters this rough patch. They're like, oh, rough patch, we don't like that. And then all the platelets are going to stick to it, right? And then you will seal the leak, and that's how you stop a bleeding, right? Yeah. However, the blood does not distinguish whether the rough patch was caused by, a thumbtack in your hand, or if it's caused by other things. So sometimes what happens is if a person have a high cholesterol, for example, okay, if they have a buildup of fatty substances in the arteries, okay, because of a diet, for example, those fatty substances would form a little patch right here. Okay, so when the blood goes by, they're like, oh, rough patch, that's not a good thing. And so they will start sticking onto it, okay, and form a blood clot. And all that clotting is going to cause inflammation. Inflammation and blood clot. Okay, and as time goes on, what happens is, because now it's a bigger area, right? So you will have more things stick to it, and more and more and more and more. So eventually, you're just gonna have this big atherosclerotic plaque, we call it. Okay. Plaque. And that causes the lumen, the inside of the vessel, to become smaller. Okay, so this is a partial blockade. Now, this could happen like anywhere, really, in the body. If it happens in the heart, for example, then it will lead to angina. Angina, right? Which is chest pain. Okay. This could happen, in the head. Okay. And that could create like a weak spot in the in the brain, and that's also not a good thing. But before we talk about that, for the angina, right? Because the blood vessel is actually reduced in diameter. So when you physically exert yourself, when you say, walk up a flight of stairs, your body demands extra oxygen, but you're not going to be able to supply that because of this reduction in the diameter, and so that leads to the chest pain, the angina. So how do we fix that? What kind of medical intervention can we have to address the angina? Anybody remember from the lecture? What can we give people who suffers from angina? I actually looked at the people who watched recordings, right? Lots of people watch part 1, lots of people watch part 2, and then by the time it gets to part 5, maybe down to like 6, 7 people. This was discussed in the last part of the recordings, part 5. So if you missed that, please go back and watch it. And yes, we have some response here. Tyler and Mihiret, I'm sorry if I'm pronouncing your name incorrectly, but that is aspirin. That's correct. So aspirin, right? That is a blood thinner. Okay, so if you want to reduce the thickness of the blood so they pass through narrow space easier, aspirin is going to help you achieve that. That's why, when you go to the dentist, I don't know, like if you go to the dentist, and they ask you to fill up the form, they would ask, you know, are you taking aspirin regularly for other purposes? And if the answer is yes, then you have to be careful, because I mean, not you, but then the dentist has to be careful, because it means it would be harder for your blood to clot, okay, because they are thinner, right? So, you know, when you do dental work, there's lots of bleeding usually, and so the dentist need to be
Professor,
aware of that. Yeah, go ahead, please.
I have a question. Could nitroglycerin or coumadin help also?
Yes, nitroglycerin is the other thing, right? So nitroglycerin, but nitroglycerin is not a blood thinner. On the other hand, nitroglycerin is something that would cause vasodilation.
Okay.
So it will
So
open up the vessel. Yeah, go ahead.
What about if somebody is on coumadin, the warfarin?
Yeah, coumadin and warfarin, they are blood thinner as well. Okay, so
Okay.
in addition to aspirin, I think some people might be like allergic to aspirin or something like that. It's an alternative would be the coumadin, the warfarin that you talked about. Very good. Okay, what kind of surgery can we do to help with these people? Michelle said GI clinics will also ask if you. Oh yeah, okay, I didn't know that. Yep, angioplasty. That's correct. We can also do angioplasty, where they stick a balloon up your legs and go all the way to the heart where it's blocked. The whole thing is guided by ultrasound. And when they get to there, right, they're going to inflate the tip of the catheter, and the balloon's going to push the plaque flat, and then you remove the catheter, right? Okay. So a couple of problems with that. Number one, it might re-narrow over time. Right? So they might need to put a stent in, right? Stent, okay, to prop it open. Another problem is when they open this thing, when they push the plaque, you might have like debris that breaks off, and if this debris, you know, travel further down to a smaller vessel and clog that, then we can have what's called like a thrombosis, right? Which is a clotting of a vessel basically, and it cuts off supply in another part of the body. That could be bad as well. So it's not without risks. In any case, I was also talking about like this could happen in the brain, right? So that would cause the this actually caused the vessel wall to become weaker, right? Because of all these hardening, it loses its elasticity. I don't know if this is relatable to you, but sometimes elastic bands. I like to use elastic band to wrap, to not wrap, but tie. I don't know what the term is. Like those frozen vegetables, right? Like I use it, and then I use the elastic band to close it, whatever, and then I put it back in the freezer, right? And then next time I take it out and I unwrap it, the whole thing just snaps, right? Because the cold caused the elastic band to lose its elasticity, right? And when things loses elasticity, they break easily. So in the brain, if this happens, right, you're gonna create a weak spot. So for example, a sudden spike in blood pressure or sudden external trauma, let's say you slip and fell and you hit your head, that could cause the blood vessel to just explode, right, in the head where it was already weak, and you know, people could die from that. Does anybody know the name of the situation I'm describing? It starts with an A. This is like, you know, anatomy version of Wordle. Do you know what word I'm talking about? Very long in the brain, it just ruptures and the blood goes everywhere. Okay. Oh yeah, thank you. Okay, Moira, excellent. Aneurysm, that's right. Okay, ANEURYSMS. Okay, aneurysm. So that, I think you spell it. Yeah, almost right. Okay, so this is what it is. And that is a situation that occurs, right, when the vessel just rupture and then you have hemorrhage in the brain. So you read it sometimes, like people just fell down at the mall or something. They hit their head, and then they just die within hours, and that's because of like the aneurysm. There's no good way of detecting something like that, so it just, you know, happens out of the blue sometimes. Anyways, the other situation, as opposed to partial blockade, we have a complete blockade. Okay, so that's when you're gonna get the heart attack, right? Instead of the angina. Okay, so heart attack. Okay, and so what happens is that, you know, you're gonna have to go to the hospital. Hopefully you get to there quick enough, and they will give you something called like a clot buster. Okay, there are various drugs that will just go to the clot and dissolve it, and restore the blood flow. If you do it quick enough, then you would minimize the damage. And you know, afterwards they might suggest to do a coronary bypass. Coronary bypass. Okay, so there you go. That's basically number 7, but in a very, very long answer there. Let me just shrink these things. There we go. Okay, I hope that answers your question. I forgot who asked it, but that's the answer. Number 8, explain why someone suffering from hypertension should lower their dietary sodium. Okay, so this has to do with the osmotic pressure we were talking about, right? So again, let's draw our favorite blood vessel right here. That is your capillaries. And we were saying how there are lots of solutes inside, right? Okay, there are proteins, there are electrolytes. The main electrolyte is going to be the sodium, okay? So if you take a lot of salty food, right, over time, you might increase the sodium level in the blood like that, okay? And as such, you now have more solute, right, in the blood vessel, which would then cause more fluid to go into your vessel, right? So increase sodium in blood equals to increase in osmotic pressure, which leads to increase in blood volume, which leads to increase in blood pressure. Okay, so you often hear people say if you have high blood pressure, then you know, don't eat stuff that are too salty. Okay, no KFC, no fast food because of this. All right. Okay, application questions. Let's just do the multiple choice of those first, and then I will explain. You know, let's do this one first, maybe. So on the test, you will get application question that looks like this, something that, you know, we have never talked about in class, but then you have to use what you've learned to answer it, right? All right, let's pause for a second. I'll show the results and then I'll explain it. Yeah, so over here, let's go through this application question, which will prep you for the actual one. The congestive heart failure occurs when ventricle fail to empty its content completely. Speculate what happens to someone if congestive heart failure occurs on the right side of the heart. Okay, and then what happens if it occurs on the left side? So let's draw a diagram and see what's going on. There's the heart, Okay, and you should know by now that the heart looks nothing like that. I don't know who thought of the heart to represent heart like this. It's just bizarre. But here is the 4 chambers. We have the right atrium, left atrium, right ventricle, left ventricle. Okay, and so let's talk about right. Is that what it's asking? Yeah, right congestive heart failure. So normally what happens is the blood from the right atrium is going to go into the right ventricle, and then the right ventricle is going to pump the blood to the lungs, right? Okay, but in congestive heart failure, the question tells you ventricles fail to empty its content. So instead of, emptying all the blood like that, okay, you will have a little bit of residual blood, right? Some leftover blood that's not completely empty. So what does that mean? How does that affect you? Well, next time, the next cycle, when the right atrium try to empties all of its content into the right ventricle, it won't be able to do that because there is some leftover blood from the previous contraction. And so the right atrium will also have a little bit of blood left over. Okay, which means next time when the vena cava, the superior and the inferior vena cava wants to empty their content, they won't be able to, and it just creates like a backlog, right? It's kind of like a car accident occurring on the highway. It causes a backlog of traffic and it just jams up the whole thing. So where did these vessels come from? Well, these vessels are from the body, right? From body. And since, again, the human here, the heart is right here. Since we are pooling blood in the body, and because of gravity, then most of the blood will now be pooling at the lower half of the body. And that would cause the increase in blood volume in the lower extremities, which would then push more fluid out of, say, the legs, right? And that would cause swelling at the legs. So that's right congestive heart failure. On the other hand, if you have left, excuse me, my allergies is in full swing. We have the left congestive heart failure. That occurs on the other side. And this time, you are not able to empty your ventricles. That means you're not going to be able to empty your atrium. And the left atrium is from the lungs, right? Okay, so this is all from the lungs. And so you will have accumulation of fluid in the lungs. So if it happens on the right side, you will have pooling in the legs. If it happens on the left side, then you will have pooling in the lungs. Okay, and so in this question is talking about the left ventricle. So the correct answer would be B. Okay, does that make sense? I mean, a lot of people choose A, but that would be for the right side, right? Okay. Have I convinced you why the answer is B? More importantly, if you see the same question on the test, would you know to choose this one? Not necessarily B because the answers are randomized, but to choose, accumulation in the lungs. And make sure you read the question carefully, whether it's left or right, because the answer will be different, right? Okay. One more question. Where is it? Right here. A heart block occurs when there is an interruption in the conduction system of the heart. Okay, so we have the SA node, which then sends the signal to the AV node, right? And from the AV node, it goes to the Purkinje fiber. Excuse me, Purkinje fibers. Okay. So this is the electrical record of the entire cardiac cycle. This peak right here, the P peak, corresponds to atrial contraction. And then there is a little bit of lag here, waiting for the signal to go down to the Purkinje fibers. And that would be the ventricular contraction. Okay, and then the rest of it is just like the heart resetting itself before the next contraction. So here it says a heart block occurs when there is an interruption in signal conduction system of the heart. In first degree heart block, the conduction from SA node to AV node, it's delayed. What changes would be expected on the ECG for someone with first degree heart block? Okay, so let's see what you think. Here's the question. Okay, let me launch the poll again. Okay. First degree heart block, what's going to happen? That's basically what it is asking. Okay, a couple more seconds. Okay, and the correct answer is longer interval between P and R, right? P is the atrial contraction, R is the ventricular contraction, like I told you. And this is the time where we're waiting for the signal to go from SA node to AV node. And if there is a heart block there, then you're going to have a longer interval for PR. Okay, so those are the kind of application question you might expect on the quiz. Okay, let's see. We did that in the, okay, so let's go through this one. Label the conduction system of the heart. All right, so over here, located on the junction of the superior, this is superior vena cava. Maybe I should label that for you as well. Superior vena cava. This is the right atrium, right? You would have the SA node right there. Okay, so this is the pacemaker. It sends out electrical signal that will spread across the atria. Okay, so some of the signal will go down to the AV node, okay, which serve as a relay station that would then pass the signal to these Purkinje fibers that are located in the septum as well as the ventricular wall. So that's the Purkinje fiber. Okay, and all these stuff that are in between, we'll just call them AV bundles. Okay, they would just help link everything together. All right. So describe a series of events that takes place as the electrical signals pass through different parts of the conduction system. So SA node, right, sends the signal and it's going to go down to the AV nodes, right? I said. And at the same time, the signal will spread across atria. Atria is the plural for atrium. So what's going to happen during this time? Okay, so number one, we have atrial contraction. Okay, when the atria contract, then the ventricles must relax. Okay, so this is systole and this is diastole. Okay. In order for the blood to go from the atria to the ventricles, by the way, both sides squeeze at the same time, right? Okay. And in order for the blood to go from the atria to the ventricle, the AV valves must open while the semilunar valve close. Okay? We have to close the exit, so to speak, right, to fill up the entire ventricle. We don't want the blood to be coming into the ventricle and then some starting to leak to the lungs or to the aorta. Okay? We want it to be completely filled up first, and then we're going to send the blood all at once. Yeah, so that's why when the AV valve opens and let the blood comes down, you got to close the exit so they don't prematurely go into the pulmonary artery or the aorta. Okay. And then blood moves from atria into ventricles. And then the blood from the AV node, it's going to go to the Purkinje fiber, right, through the AV bundle, right? Purkinje fiber. Okay. And then basically, what happens next is the complete opposite of this. Okay, so you can do that on your own. I'm just going to verbally tell you. Again, it's just the opposite of these things. So instead of atria contracting, now the atria is going to relax. Okay, so then they could be filled up with blood from the superior vena cava, inferior vena cava on the right, and from the pulmonary vein on the left side. Okay, and as the atria are filling up, the ventricles will be contracting. They will be squeezing, creating one squeeze, so that it will, go to the lungs on the right side and go to the aorta on the left side. But in order for that to happen, the AV valves would now have to be closed. We don't want the blood to go back to the atria. We want them to move forwards, right? Okay, so AV valve will close, but the semilunar will open. And that agrees with what I told you before, right? The AV valves, they operate in synchrony, but then it's going to be out of sync with the semilunar. And when this happens, the blood will be empty from the ventricles, and they will either go into pulmonary circulation or they will go into systemic circulation. Okay, so you should be able to write those points yourself. Okay, last but not least, we have this picture right here. I mean, we can color it together if you want. So oxygen-rich blood is shown here by the, we'll do it in pink right here, oxygen-rich blood. And of course, that starts on the left side of the heart, right? Okay, so left atrium and left ventricle, they would both be rich in oxygen. And then you can see it's going to go through the aorta right here. Okay, and it's going to go up, right, to the heads and arms. Okay, and it's going to arch down and become the abdominal aorta, which would then supply blood to the lower parts of the body. Okay, it's terrible coloring, but you get it. So what do we call this circulation? This is systemic circulation. Okay? The purpose of systemic circulation is to get those oxygen to your tissue. Okay, systemic circulation right here. Also, systemic circulation to internal organs and legs. Okay. Once that happens, then the blood becomes blue, right? So to speak, not literally blue. So it's going to come back here and it will go through the inferior vena cava to the right side of the heart. Same thing for the top part of the body, right? Okay. Where then the blood will go to the lungs like this. Okay. So in the lungs, they will go from blue blood back to red blood before returning to the heart. Okay, so this part where you send the oxygen poor blood to the lungs for reoxygenation rather, that is what we call the pulmonary circulation. Okay, so systemic is to get the oxygen to the body tissue, whereas pulmonary circulation is to recharge the blood, to add oxygen to it. Okay. So just for completion, just color it. Oxygen poor blood, baby blue color, and then oxygen rich here. Okay, let's fill in what we have. Over here, B is pointing at the aorta. Okay. C is pointing at the left atrium. E is pointing at the left ventricle. So if you follow the aorta, eventually it becomes a little bit smaller. So O is referring to the arterial. It's a smaller version of the arteries, right? Which then becomes the capillaries here. Okay, and this side is going to be the arterial end. Okay. Oh, actually, you know what? I think I made a mistake. This is the aorta, and then it's going to become artery. And then it's going to become the smaller version, which is the arterial. Sorry about that. Then the actual capillary. And over here, it's going to become the venules before joining together to form veins. From the veins, it is going to go up here and become J, which is the inferior vena cava, before returning to the right atrium. Okay. Over here is the right ventricle. You're not going to get something this complicated to label, right? Like there's many things pointing at things that are not very clear, but nevertheless, it's a good diagram to just, summarize everything. And we have two more here. Zoom in a little bit to see. H is pointing at this vessel that's taking the blood to the lungs. So that would be the pulmonary artery. And then this one is returning to the heart. So that would be pulmonary vein. Okay, so that is it. That's the entire study guide. Okay, well, thank you. Thank you for your attention and thank you for coming to the tutorial. If you have any question between now and next week, please feel free to contact me. Again, start studying. The quiz is going to be next week. We'll try to do some review next class, but you got to do most of the heavy lifting yourself as well. All right, enjoy your week, and I'll see you next Thursday, same time. Bye for now.